Television, the Gambia's first non-profit online public broadcasting network and home of culture and entertainment. At GTP, we bring you the best of Gambian creativity right to your doorsteps. Sell your products and services to millions of Gambians and friends of the Gambia via our online radio, TV, and newspaper. Advertise your business and watch your clientele grow like never before. Our content from the Gambia gets the diaspora hooked up to our screen, whilst those in Gambia love what we bring for them from afar. This gives us a unique edge and separates us from the rest. If you want to be heard or seen by the world, contact GTP. We tap, nurture, and promote Gambian talents and businesses. Think promotion, think GTP. For all your event coverages, religious gatherings, naming ceremonies, weddings, documentaries, music videos, TV and radio commercial, and more. We also do design and print jobs of all types, logos, business cards, brochures, flyers, t-shirts, coffee mugs, banners, billboards, catalogs, and magazines. We also do lamination and projector rentals. We are the first Gambian non-profit online public broadcasting network with over 300,000 active followers across all social media. Contact GTP on 750-3654, 750-3654 or 794-9214, 794-9214, 404-593-6215 or email us at gambiantalents@gmail.com. GTP, the people's power.
From Gambian Talents TV, we are right at the Fajikunda Health Center where a cleansing exercise is being organized today by the staff. And as the saying goes, cleanliness is next to godliness, and a clean environment too is a healthy environment. That is why the staff today deem it necessary to invite the community of Fajikunda and those living around this place to come today and help in cleaning the environment. So we're here today to see what exercise is going on.
My name is Baba Jabi, Councillor for Fajikunda Ward.
What brought you to the hospital today?
Okay, thank you very much. Alhamdulillah Rabbil Alameen. Sometimes last week, I was given a letter by the CEO, maybe, Ramatulai, who wrote a letter to me and invited me to a Setsetal in the hospital, which is slated for on the 3rd of October, which is today. So this is the reason why I am here today.
Is this something that is usually done, or is it the first time that this cleansing exercise is done?
No. This I've been doing for quite a long time. It's only that this one is organized by the hospital management itself. But normally we have youth within the wards and outside the ward who normally organize such things like this. I could remember sometimes back the Tailor Association of Larikunda, Fajikunda, Tabokoto. I can say the Tailor Association of Larikunda, they organized a similar thing like that. And there was one group called the UDP Home and Diaspora Youths within Fajikunda and Larikunda. They also organize the same thing, and other youths also who normally organize things like this. So this is not the first time, actually. To be precise, this is not the first time. Really.
How do you usually disseminate information when it comes to activities like this?
Yeah.
Because
Okay.
we've seen the number is not very large, though they're really trying.
Okay.
But there are only few people on the ground.
Yeah, definitely. Okay. Normally, what we used to do when we get such information, then what we do, we have social forums here youth forum, village forum, and things like that. This is where we normally put our information and our message. We call the youths and other people who are willing to come and help, to do such things like this. Okay, but it was a mistake that I didn't announce it very well, to be honest, because I was just given a letter that I was invited to a Setsetal. So, but I was thinking that, they have to organize it well and they have to get information to their people, as it used to be. But what I'm seeing, and they also think that I will get my youths. Anyway, to be honest, I have some of my youths here because I informed some of them, but it was not announced how it should be. Otherwise, you will see a lot of people because I have a lot of youths in Fajikunda who are always behind me. Anytime I call for help, they always come to my aids. Anytime, any night, any day. So the only thing I want to say, it was not well, announced. Otherwise, you will see a lot of people here. We will not be here by this time. By this time of the day, everything will be finished. Really.
Well, actually, what was the motivation behind visiting the hospital to attend this inauguration of the clinical research? Because we have said it is because of you are a ward councillor, or it is that you see that it is necessary for the environment of the hospital to be clean?
Yeah, definitely. The cleanliness should be the priority of everybody, not the hospital worker, not the councillor, not the alcalo. This should be the priority of everybody. If you clean yourself or you clean your area, that means you clean the whole area. This what will bring the healthiness, and definitely this what will bring the healthy within the community and within everywhere. So whenever you clean a place, that means you are running away from the disease. So this is why always when people call for cleanliness anywhere, I must put my step onto it. That's it. Yeah.
Dawdali. Wow. Man regional vector control officer. Regional vector control officer. Waaw dëgg la xam nga Setsetal bi fañ ko dee faral defal toujours ci lopitaan yi soo bay xel lopitaan mooy place bu nga xam ne nit foofu la di ñëw pour faju soo dafa war a nekk place bu nga xam ne always dafa set loolu moo tax waa lopitaan bi toog gis ne lopitaan bi ñax yi ak tilmi yu fi nekk war nañ mën a dajaloo setal ko pour génne ko ci biir lopitaan bi. idea ñu dee liggéey fii si biir lopitaan bi nurse yi ak health officers yi ak ñu fi dee liggéey yëpp ñoo toog gis ne place bi daal nu mel xal na ñaaw tuuti xal na ñagas yëpp lu ko waral na because of this corona am na jamono yu bari ñu ngi toogoon si kër nekkuñ di ñëw liggéey moo tax ñoo ñu du waroon a bale wala du war a setal fii sax nekk ñu woon di ñëw moo tax léegi bañ commencé di liggéey nag gis ne léegi mun na ñëw setal place bi moo tax ñoom ne ñu toog waxtaan ñu ne na ñëw organise setal pour ñu mën a setal béréb bi waaw bañ ko defee nag ñu informe ñu as regional health directorate ñu ñëw fii nii pour ñu tamit participer def suñu wargal ci setal bi. waxtu bu nekk fañ ko dee in fact lopitaan bi fañ am a work plan almost every 3 months or every 6 months fañ dee dajaloo ñu def setal loolu seetu nawet la wala nekkut nawet every time daal fañ dee dajaloo ñëw def setal fii si lopitaan bi léegi dafañ dee inform community bi pour ñu ñëw jàppale leen wante xam naa te xaj na maybe because of this corona moo tax ñu bari mënu ñuy ñëw daanaka ñu fi ñu nekk yëpp staff yi lopitaan bi rek la.
information bi moo demutoon nu mu waroon a demee ndax lopitaan bi dañ fi nekk moo si rek ñoo waroon a involve seen bopp si cleaning exercise.
No, actually information di moom na si committee because for na gis nga fi alkali Fajikunda bi mu ngeen fii si suba te participate na youth si tamit somewhere inform wante lu ma la wax daal mooy problème because of this corona ñu bari fa ñu ngi ragal ba léegi nii lopitaan soo fa demee mu nga fa am corona ak andi like foo na loolu mu ta daal ñu bari nangu ñooy ñëw wala ñëwuñu daal waaw wante inform nañ gars yi inform community because gis nga fii alkali bi si boppam moom si boppam mu ngeen fii nii te participate na.
ban advice nga doon am pour community bi in case ngeen amaat beneen Setsetal bi ngeen bëgg a def te information bi rëcc leen ban advice nga leen amaloon pour turnout bi wala pour seen participation bi towards the cleaning of the hospital.
jërëjëf laajte boobu am na solo trop soo seetee lopitaan bi is a tertiary institution next to hospital mooy Fajikunda te KMC yëpp su dul hospital yi bii moo gën a rëy te lopitaan bi nag biir Fajikunda fii la nekk soo waa dëkk bi sax war ñoo aar sax pour waa lopitaan bi ñëw di la wax pour ñëw la ñu def Setsetal ñoom ñoo war a ñëw gis ne lopitaan bi seen lopitaan la ñu xam ne lu fi am tamit ñoom la ñu organise Setsetal ñu ñëw informe ku nga xam ne moo nekk jiiti lopitaan bi dañu génn si Setsetal lopitaan bi bu ko su setee ñoom la lu fi am tamit ñoom ñoo fi dëkk ñoom ñoo koy fees in the long run balaa kenn di ñëw di fi am leneen ñoom ñu fi dëkk ñoo ko day am soo baaxoon na toujours yuur si ak waa dëkk bi ñu organise Setsetal ñëw fii nii Setsetal lopitaan bi bu ko seen lopitaan la.
man bëggoon naa laajte a question not really in relation to cleansing exercise but because yow yaa ngi liggéey as ministry under the Ministry of Health ay fan yi passé gisoon nañ ay jigéen ñu génn di wane seen naxar si jigéen ñi dee si childbirth waa maternal mortality bi ñu ne mu ngi bëri si biir dëkk bi lan nga amoon pour wax si loolu.
waa xam nga soo ko bàyyi xel ray daal sax ñu ngi war a am meeting this week on that issue moo tax duma si bëgg a wax lu bari wante noonu sani ray na jamono bi lu xewoo mooy affaire this corona could have been a contributing factor because da ngaa seetlu ne lopitaan yi liggéeykat yu bari fañ leen wàññi woon même ñu dee liggéey sax ragal nañ pour ñëw liggéey so loolu yëpp mën a nekk facteur su nga xam ne mën a contribute wante comme ça ni ma la ko waxee rek ministre bi ñu koy am meeting next week si région bi fii nii discuss that issue because comme ça ni nga ko waxee it is a concern ñun ñëpp jaaxal nañu te insha allah den si taw gis ne loolu dafay jee takk. jërëjëf.
Good afternoon, how are you?
Can you kindly introduce yourself?
I'm Mrs. Ramatulai Kamara, officer in charge Fajikunda Major Health Center.
Madam Kamara, can you please tell us what motivated the staff to come out on a day like this to help make the hospital clean?
It has been a routine work or routine exercise that we normally conduct at least every 4 months. It has not been the first, as the ward councillor was saying, neither the last. It will ever be the last. It has been a routine. It's just that it's so sad this time the turn-up is a bit small because the communication was not properly set at the community level. Because actually we wrote to them like 2 weeks back and we even give them a reminder call, hoping for them to inform the community to come. But normally the community they used to come, or maybe it might be they are informed, not large amount of them were here. But we have the president of the Akalo was here, and himself, the world councillor, was here. So it has been a routine work for us actually. Yeah.
How has this clinic impacted the patients in the hospital?
As he likely said, an healthy environment is an healthy person. So when the environment is healthy, obviously there are a lot of diseases that you cannot be infected with among the environment. So you find that if we clean our environment or we clean the facility, patients are the bulk of people are coming here. So we reduce the outflow of patients going in and coming in for the same conditions. When your environment is clean, they come, they will feel, I think they will be cured, and you have less work to do at the facility level. So, and the environment and the facility should always be clean. This is about life. We're dealing about life here. So people come here to seek health, and if they're coming here to seek health, they expect the place to be clean, not to be as dirty.
Mr. Lee said that coronavirus is contributing factor to the reason why the hospital is like this. I mean, because
The turnout, you mean?
they believe the hospital was closed.
The turnout, you mean?
No, not the turnout, as in the way this place is, at least it was closed for a long time. Was the hospital closed for a long
No, it was just for a few. Just for a week, I guess. It was a week, just for a week. It was a week. It's like the contributing factor because will be every pour down of rain, because like I told you, like every 3 or 4 months there's a general cleansing exercise, and it was done not even long ago. So you see all the grass, because it's heavy rain, so the grass start growing again fresh. So that would be a contributing factor.
How has the virus affected your hospital?
Maybe, yeah, because what happened when this whole issue of virus started, we scaled down the amount of health providers that are coming just to minimize the rate of transmission. So at the same time again, we scaled down the amount of patients we see per day. So that was not from us, it was from the authority, so we scaled down. Maybe there was a low turnout of patients coming to the facility due to the virus, because the concept we were having that, because we had a case that a patient was positive here, so it like the hospital was closed down for fumigation for some days, and that affect actually the populations around the community, having a very negative thought about, if I come to Fajikunda, I might be infected. But actually, I think that one is already phased out, because we see a lot of patients coming in now, because we've already evoked that scale down of work, so everybody in the full workforce coming to, yeah, I don't think.
Even like the minimum number of people who came out, the turnout was low, but the work was productive and it worked. So what do you have to say for this week?
No, it's a bravo for my team and the Alcalo. Then the representative from the RT, Mr. Dowdali, is representing on behalf of the RT. And actually, I myself was surprised because it was heavy work, and we are very few in number, but it's like it was an excellent job done. So I just say bravo and then thank you, and thank you to people for people to be here at least to get a coverage of what is actually going on at Fajikunda Major Health Center, and I thank you very much.
What would be your reaction to the allegations that Gambian nurses are not doing what is expected of them when it comes to attending patients, most especially women who are pregnant?
It's a sad for people to say that, but I always say everybody have his own view. To speak what they want to speak is their own view. You might have a rough experience with one person, does not mean all Gambian nurses are like that. So I can't say much in that area. It's a concern for all of us. But there is one thing I want to say to the Gambian population. How wicked or heartless you, a health practitioner, is. Nobody wants a woman to go through labor and die in their hands. Nobody. It's something that psychologically disturbs you as an healthcare provider. Did you fail to do certain things that you need to do? You didn't do it. But sometimes it's like when the negative side comes, it's pumped to the health provider. And most of the time, if you look at it, it comes from the patient themselves. Because you tell them come for booking earlier, they will not come, and you indicate it on a patient folder. Don't deliver at an hospital. Go to at the health center. Go to an hospital. They will come to the health center. You are already informed. Were you not informed? What can you do at that initial state? Sometimes they themselves are becoming so stubborn. That's why it's very good if their men have to come up to help their wives. At least doing pregnancy is not a one-man job. It's both the family and the man himself. The man should be really involved in this, because it's giving us as health professionals a big health problem. Sometimes we educate them here at the RCH. You talk to them when you are in labor. You have to, before you get into labor, bring this, bring this, bring this. Can you imagine a woman walk into labor without nothing? And at the end of the day, you tell them if you are in labor, go, and sometimes you go and do your HB. Let's know what, because most of the thing that is killing many Gambian women are anemia, low blood. They will bleed during labor. You will tell them your blood is not enough. Go, you buy them a medicine to go and buy. They won't buy it. What are you going to do there? And they will come when they're already at the dying state, and you can't do anything about it. And the blame come up to the health patient that the hospital went to this social hospital and the patient died. I know sometimes you have negligences with the but most of the fault should be to the patient himself. And sometimes this is a systemic problem. I don't lie to you. It's a systemic problem.
Okay, you did mention that sometimes you ask them to buy medication and they do not.
Yeah.
Some it's because I believe they do not have the finance to do that. How would you rate the hospitals? Do you have enough medications?
No, it's one thing we have to understand, and Gambian people need to understand, which is when they say free, there are some medication, they are essential drugs. You need them at the hospital. It's a must. It should be provided by the government. But there are some, it should be provided by the individual themselves. You understand me? Like they give them the folic, which is free for them. They don't pay for it here, and they go home. But if this other, like these other blood tonics, it's not the work of the government. Those are not emergency drugs. They are not of necessity to us like that. They are important medication, but we feel that people need to involve in their own care themselves. Because when you're telling somebody everything is free, they tend not to value it. But anything they use their own money to do, they tend to value it. So that is the problem, because we can never have free. There is no free health service in the world. Even in the developed country, you pay indirectly or directly through your social security or anywhere you pay. But the thing is, people go in the concept that when you come to the hospital, you have to have everything. It's not possible. You can't have everything. You have what is important, like essential and primary drugs. You will have it, but some others you need to go for it. You need to go for it.
Well, actually, the Ministry of Health was informed about the exercise, and we have seen that they really turn out the base education as exposure.
Where? Concerning the?
Like the Ministry of Health, we are informed about the exercise.
No.
Do you see that they turn out?
No, we are not. We didn't inform them. Normally, we deal directly to our regional directorate. That's why I say he's a representative. There is like it's not like this is the first time this exercise has been done. So it's a routine work. So normally we write to the directorate, and he called this morning that he is not feeling fine. He usually attend our cleansing exercise. That's why he even sent a representative for him to be here. So it's our directorate, not the ministry as a person. It's okay.
Thank you.
It's okay, thank you.
Landing, lan mo la fi indi tay?
First of all, I'm a native of the community. Plus, also I'm a health worker. I'm a public health officer working within the health facility. So, as far as environmental cleanliness is concerned, I'm a public health officer. I'm the lead of it. So I have to be there.
How did this idea come about?
Actually, as far as health is concerned, we think cleanliness is one of the means to promote health. So as health promoters, if you heard of public health, we are health promoters, and prevention is better than cure. We say more on prevention than curing. So cleaning your environment is one of the means that you can prevent yourself from having some of these diseases. So that's why the idea came. It's always within us. It's part of our TORs. That's why always. It's not about an idea that need to come. It's our responsibility. That's why we are here to do it.
Is it something that you people will be planning to continue doing? Because you said you've been doing it for the previous time. Will you continue doing it?
Like I say, it's our responsibility. So the question of continuing is there is no need, because it has to continue. As far as you want to prevent people, you have to continue cleaning the environment all the time. So it has to go on. It's a process that needs, it's not in fact calling up one day. It's a process that needs every day. So like every day we will talk to patients that come here, the healthcare workers, how will they manage their waste. So when it goes after a time, it's whereby we organize a cleansing exercise. This cleansing exercise is mainly because we are from the rainy season. We are still in the rainy season, but you can see everywhere there is grasses. So we want those grasses to go off so that some of these microorganisms can go away from us as far as this hospital. Yeah.
We were informed that the community of Fajikunda was invited, but when we came to the ground, we saw only few members that were present. What advice would you give to the whole community in case another Setsetal is called upon again?
Yeah, like the community of Fajikunda and other communities are invited. I will not say Fajikunda as of only Fajikunda, because if you're looking at the health facility, it covers around 8 catchment areas. So we invited all of them, the council, the ward councillors, the alcalos, and everybody. We know everybody is engaged, but this is something that they need. We are here for the community. So that community, if they need their health to be promoted, they have to say it. Because they say if you prevent yourself, it's more important than someone trying to prevent you. That person that need to prevent you need to see your support. from you, the support from you, so that the person can help you. So we will urge all the youths to come over, because this if you say you want to contribute in nation development, it's not only being a president. What you can do, even no matter how small it is, like this is part of nation development. So you can help your community in that. So I believe every youth in the nation, not only Fajikunda, whenever this kind of exercise are there, they should engage on that so that the country can move.
Okay, I would want to ask a question in relation to allegations that are made by women and men out there saying nurses in the Gambia do not do what is expected of them. A few days we saw women marching peacefully, showing their anger towards the government, saying the government is not doing what is expected of them, most especially in the health sector, because what is needed in the health sector is not there. What do you have to say to that?
Yeah, like I say, is that all of us have to put hand on that. Yeah, every level have to play its role. Like, yes, there is this allegation, but I think the question that every Gambian need to ask is, what am I doing? What am I doing to help the health sector? If the highest level is not doing good, am I helping myself? Whenever I feel sick, do I go to the hospital? Do I actually go to the hospital to seek for medical care? Do I go to other private sectors? Do I go to pharmacies? So these are the questions. I think it's a question whereby each individual need to answer it by your own. That every development, it needs stages. Yes, the highest level need to do their part, but you yourself, did you do your part? Before throwing allegation to someone, you need to do your part first. Clear your road, then try to maybe put allegation on other people who put obstacle on you. But yeah, it might be I cannot fully deny what they are saying. They might be right, but my question is they are not doing their part too. So this is what I have to say on that. Yeah.
Thank you.
Yeah, thank you too.
Yeah, alhamdulillah, I'm back finding.
Naka
Ante tom Bakar dan solti.
Bakari mune nati jambi.
Okay, ela nyini karo kumata bake narada because mbenga nako jamal jada kenda fementa kumata bakele femfenta no jada kenda wala koma. So ngaji ko wajibi kul menkata na able council de Fajikunda ward ka bayan kibar ko loptan ko liya fal ko ngila faka clean exercise ke loptan rojang mfanam volunteer program ka fuma jang.
Okay, at all alia moy from council on wala tina al nataja. Albe prepare la pour kana always ning ye mol commandi police na Setsetal labang.
Thank you very much. Nyinde ndresinya for kanajang ne hakebe ko das kena wankete nyala, but last year September 22nd international yunja me ko based on protocol line under 20 home and diaspora the vice president Lamoti nata jang jambe senandi amanka jenda mad ndara jamol to kata marshal to kaje financial because ngay ko yada kende amu nyon tangalte so fananga ko wajibi kudi seru nata janne di safana nata jang prana kafuma
ibe advice soto la ka fo molie mimana ka ko ya fole ko ni Setsetal is very important. So what would you have to say to Monmi alon ko be siri ila suo ko na imantara fenka for next time if something like this should happen yena nang yal join pour access jankle.
Yeah, thank you very much. Being on the jang, abakake mo dianya kutena jang. Kana jang kami ka maybe yena jang maybe niye mo je jama jada kende bala ke si jang. Omanke mo barbidum being on nako mo morandi ideta bang wala bade wala lomo akana lopta janne. Despite the dunia abola kono kolane diala mu sa fana jada kende so jada mo kasema first na ya janto. So mbemo be encourage la ni nyasi ma fa ni ma moy de. But ni ya moy is good you volunteer if nek fu mo men ko bina e fambole fando kana jang momi na molbe le volontaire imam mo jokko le pour kana janto ngana tamu be because ngal jamu bimbi kenolti nka futa molima ka wena elfa ko men ka council di hono bawa jabi nka futa pour kana jangaje ko wajibi kulam despite the fact that I live around this and be Fajikunda wodjane so ngaka nyontade mbe yuso farade moto makoto mbe encourage pour ni sifani ya moy mbe ka fu nyom banku do kolam sa do fana do kolam because community service is very important. So I will urge all other people whom you know me believe around any other end within Fajikunda ye kafu mom ni sifala moy whether loptano ba loptano to ba ni am fenko community do ko denga kafu nyom is collective responsibility.
Thank you.
Abaraka bak, thank you very much.
came to the end of the cleansing exercise today, and we spoke to different individuals that are on the ground. Some said the cleansing exercise, though people were not very much present, but it's very productive. We spoke to some of the health workers, and they gave their concerns concerning the environment and calling on the community to always come on board when such activities are being organized in order to help to clean the environment. This is all we have for you today, and thanks for watching.
Supersonics Money Transfer is giving you an unbeatable offer this Tobaski. Your family and friends can now send you monies from the whole of Europe, US, Canada, and Switzerland for absolutely free. Yes! This Tobaski, enjoy our safe, fast, reliable, and convenient money transfer service with the largest payout network in the Gambia at zero transfer charges. So your family and friends wouldn't have to worry about transfer charges when sending you monies from Europe, USA, Canada, and Switzerland this Tobaski. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics. Support your own. Tobaski just got better with Supersonics Money Transfer.